Local programming on KRWG made possible in part by viewers like you. Thank you.
Welcome to Fronteras, a Changing America. I'm Edmundo Resendez. More middle-class Americans are crossing the border to save on medical care, dentists, and prescription drugs. Erica Lang reports.
I'm here in Nogales, Mexico, just a few steps from the border, where on this block alone you have dentists, pharmacies, and other medical services that cater specifically to Americans. These musicians are playing a song about the scenic beauty of Sonora. But many Americans also cross the border looking for something else.
My dad told me I could get my teeth cleaned for 35 bucks.
And the savings quickly add up for major dental work.
You're gonna spend 2,500 bucks in the States and you can do it for $800 here. You know, makes sense.
The cost of both private and public insurance has increased along with deductibles, and some services are not covered at all. It's especially difficult for retired Americans.
They have no insurance except Medicare, so they have no dental insurance, generally no eyeglass insurance. They have to go where they can afford it. And so if that means coming down here, that's where they go.
Take care of yourself.
Americans also go to pharmacies in Mexico for low-cost prescription drugs. Cristian Juarez Romero sees it all the time.
Their insurance doesn't cover the medicine, so it's very expensive. They prefer to come here and not spend as much.
Customers pay half price for some drugs in Mexico. And as medical costs continue to rise in the U.S., more Americans are expected to see Mexico as a solution.
Absolutely. Each year it increases the number of people that cross the border to get medical care.
The Reed family is among those who will continue to seek savings south of the border. In Nogales, Erica Lang, Cronkite News.
The Bi-national Breastfeeding Coalition held the 6th annual Big Latch event in El Paso in August of this year. Rosalba Ruiz-Holguin is project coordinator for the Alliance for Border Collaboratives in El Paso, Texas. She is our guest on Fronteras and Changing America. She is here to discuss the event and the importance of breastfeeding. Rosalba, welcome to Fronteras and Changing America.
Thank you very much for the invitation.
Let's talk a little bit first, get the conversation going with what is the Alliance for Border Collaboratives?
Well, the Alliance of Border Collaboratives is a nonprofit organization, and we've been established since 2009. But a lot of the people that are there have experience of more than 30 years experience working in border health, and they all of the members previously worked at the Pan American Health Organization or at the U.S.-Mexico Border Health Association. And we do basically public health, and that goes from collecting a survey to designing program studies. We do research, we design curriculums for trainings, we do media campaigns, we do awareness campaigns. So we have a whole gamut. It's a small outfit, and we work locally, trans-border, and binational, and even international.
Well, let's talk about the Big Latch which is a big project that you undertake. What is the Big Latch
Well, the Big Latch started in New Zealand, and it began because we needed to, we were seeing a lot of discrimination really against women that were breastfeeding in public. So this is a way that breastfeeding women feel support, but also we're creating awareness about breastfeeding and how important it is.
So how did it begin? I mean, was this just a grassroots organization, a grassroots campaign that is now international?
Well, it started, it has a little bit of more of a backstory because in England back in 2005, they started seeing that that people were looking weird, women that were breastfeeding. So
they were frowned upon.
Yeah. So or people were really rude to them, or they were asked to leave and stuff like that. So they started first the Baby Cafe. So the Baby Cafe is a place where breastfeeding moms can go and they can share experiences of if they're having issues, or just to have like a support peer people that are supporting them that are doing the same thing. But the thing is that they have a lactation expert if they have any questions. Okay, so then what happened with that, and they started all over the world, and in the United States, El Paso was the second city that had a baby cafe, which was awesome. And they started, but then people started saying again that you shouldn't breastfeed in public. Well, go to the baby cafe, you know. But women right now are very mobile, and they carry their babies, and they should be able to really breastfeed anywhere. So that's back in 2010. 5 years later, in New Zealand, they said, you know what, we have to say that we have to do it in public. So it started, and as I said, in 2010 in 2 sites in New Zealand. And then from there, I guess we have very good communication with other countries and stuff.
Well, in this day of social media.
And that favored it.
Yeah.
And it started with 2 sites, and now we have in 1 country, but now we have 28 countries that are participating, and more than 500 different sites.
And El Paso was the second city to participate? Or it was one of the early cities?
No, it was one of the early cities because it's been around for 7 years and we've done it for 6. So we missed out on the first one. So yeah, we were one of the
How many people showed up for the first event?
We've been very lucky, and all of the years we have between 100, and our goal is is 80 to 100. Our goal is to hit more than 100, but it's been hard because there's not only here in El Paso, only 16% of women are breastfeeding. So 80 people, 80 women that go, and actually breastfeed, that's very good. So we oscillate more or less, but it's the most that we had was 80, the least was 82, the most is 87.
Why is there such a stigma with breastfeeding in public? Why is it frowned upon?
I really don't understand myself, but we believe that it's because the way that the culture is, in the sense that they're very liberal in one things and very conservative in others, and to me, I don't understand it because here in the United States, you can see movies where women are very slantly dressed, or you have programs that are critically playing with nudity all through it, and you see a woman breastfeed, and people come up to them and say, "You're gross, you're disgusting, do it at home." Or other women telling them that they're like flaunting it, or like it's exposing themselves, and it's not. The only thing that they're doing is that they're feeding their baby with
what's natural.
What's natural, yes. And why does it's a cultural thing. So that's why you were saying right now, and as your program says, that you're changing America. And actually, if we increase the numbers of women that are breastfeeding, we have the potential to change the face of healthcare in America and the rest of the world. Because like Mexico right now is the Latin American country that least breastfeeds.
That least breastfeeds?
That least, So right now.
Why is that?
Because they imitate a lot of stuff that the United States does, unfortunately, and also because they fell into the belief. I mean, we in public health are going against big companies, and this is formula companies, that it's a business that produces for them $22.2 billion a year.
$22.2 billion
a year
in formula.
In formula. And what they have done very successfully is that they have merchandised it, that it's just as good as breast milk, and it's not, and it's really not.
Well, let's talk about the benefits of breastfeeding. I have 2 kids, 2 daughters, and they were both breastfed through the age of 1, and they were supplemented with formula, but for the most part, it was majority breast milk. And we saw the benefits to it. I mean, we had healthy kids, growing up. What are some of the benefits?
Well, I think that a lot of people do know the benefits for the child, which is our primarily focused because it was made for them, no? So basically, they don't get as sick as much, respiratory infections, digestive infections. It's very good for their immune system. They've done studies where they study a mother's milk every day until she's breastfeeding, and the content of the milk every day changes according to the needs of the baby. So that's awesome. And really, up to 6 months, the baby doesn't even need water. Okay, so the benefits for the baby is nutritional, 100%. It's good for the building blocks of the structures that because the baby's growing, for the DNA, for the proteins that the baby needs. And sometimes we have babies. We're living in a world where there's a lot of environmental contaminants that we don't even know what's going on, and it's a means of defending of the baby to have defense against those things. And we're seeing very much predominant diseases that are very
preventable?
No, that shouldn't have that so many, and yet we're like diabetes, breast cancer, autism, because we don't have a good immune system, and also it's the things that we're eating in our food, processed food and all that stuff. So you're just giving the baby the defense that they need, or the immunity for what they need. But also, it's very important because there's a rapport between the mother and the baby. It's not the same if you just leave the baby in the crib and you're doing your things. You have to have the baby's need. I mean, polar bears, mama polar bears take care of their babies. Kangaroos have their babies. I mean, and you can't separate that. And what that does is that it creates a bond between the mother and the baby, but also it makes that baby more self-confident, and so it feels loved. And sometimes fathers say, well, they're kind of jealous because, oh, well, I don't breastfeed and we don't have that. But what we recommend is that you should have the skin to skin. You let's say you're the mother and you breastfeed, and then you're done with it, and then you pass the baby to the dad or whoever is a person that's helping you raise the baby. So that's very important. But also because all of the nutrition that it's getting, it's creating neuron cells. And that helps that the babies are smarter. So they say that for every month that you breastfeed, it increases your IQ by 1%.
By 1%?
But every month. But I'm sorry, not percent, 1 point. So there was a study that was done in 2015 in Brazil, where they followed kids for 30 years, that some were breastfed and some were not. So what they found after 30 years is that they had less kids that were breastfed didn't drop out as much. They had better grades, and as they got older, they had better jobs, and they made more money. So that's another benefit. Why wouldn't you give that to your son? So now the mother, the benefits, it reduces. When I was in medical school a long time ago in Mexico, they used to say, well, the number one cancer that kills women in Mexico is cervical cancer. In the United States is breast cancer. You would go like, what? This is like the first world. Why would they be having? That's when they started not breastfeeding. Okay, so and then sometimes you say that somebody can be very healthy. They exercise a lot. They eat whatever you're supposed to eat. They don't smoke, and they still get cancer. But unfortunately, it is that if you have a gene and something triggers it, you're going to get the disease. But what it does in the case of mothers that do breastfeed is that they might get cancer, breast cancer. But the thing is that once you get breast cancer, you can survive it, no? But what it does is if you breastfeed, your longevity after that is longer. So you're going to live more versus a mother that didn't. So for that, and then it also protects you against ovarian cancer, and if you breastfeed it, you also lose your weight sooner if you're breastfeeding. So those are the benefits for the mom. But also for a business, they say that for every dollar that you invest as a business owner, it gives you back $3 back. And you can say, well, why is that? The reason is because if you have a mother that comes back to work and you let her breastfeed or pump that she can continue to give, that the baby gets breast milk, the baby's not going to get sick. The number one reason women to miss work is because they have to take the baby to the doctor. So that's $1 to 3. And the other reason is you're also going to have an employee that really is more faithful to your company because you did this for her, because a lot of people don't do it. So it's good for companies. It's good for and also for the economy of the family, because if you give formula for a year, that family is going to invest $1,500 just in formula products. If you give 2 years, it's more than $3,000. Okay, and then for the environment, think about it. How many cans of formula that they throw out, and also the bottles, and also the water that you put in there. So it increases. And another thing is the diapers. And poop is poop. And I'm not going to say that one is better than the other, but the baby.
Is it?
Well, they've done studies, and they show that if that a baby that is breastfed is going to produce less number of diapers than a baby that uses formula, because he doesn't use all of the stuff that he doesn't need all the stuff that he's taking. So that's why so even on diaper production, it's less. So that's why they
That's
say.
interesting. I've never heard that.
Yeah, well, it is. So so that's why it's good for. So they say that breastfeeding is also environmental friendly because of that.
You brought up an interesting statistic that really surprises me, and that's the percentage of breastfeeding in Mexico. But what's the percentage of breastfeeding in the United States?
Well, it's very, and you know how they can be manipulated, but basically what they say is when there's states that are going to say, oh, we have breastfeeding 70%. But what they're talking about is when they're in the hospital, when there's a lactation person that can help you, well, that's it, and the statistic really is ever breastfed. So that's when they're the mothers in the hospital that they try and they put the baby. So did you try? Yes, SAS. So that's
so it counts as a high percentage.
Yeah, but when you go and 3 months and you follow, it drops to 46%. And then when you go to 6 months, which is very important, because really all babies should be breastfed exclusively with breast milk, to 6 months, it drops to very low. It's here in El Paso, as I said, it's 60%. In Juarez, it's 14%.
14%.
So this is what we want.
What
this
role?
is what we're fighting to do. And a note, in 2012, El Paso was 14. Now in 2016 it was 14. So it increased 2%. So, and it's not a lot, but we're getting there, you know. But we need to do a lot more.
What roles do pediatricians play in this? I mean, shouldn't pediatricians be encouraging to the parents that they should be breastfeeding?
Yes. Well, the thing is that one of the things that we have to do is that we have to give this information to the doctors and the nurses and health professionals, because when I had my daughter, she was fine in her weight and everything, but if she would get like a little anything, that you know how your parents and you take the doctor and the doctor, stop feeding her, stop the breast, give her formula, and I would say like no. So there are doctors that do this still, and there's some cases where doctors say, oh, you have diabetes, you cannot breastfeed, or you have this, and really there's a lot of discrimination that goes on, because or they think that it's hard, and really it's not that hard. It's just that we don't have the information, and that's why we're here, because we want to tell you that if you're pregnant, there's places that you can go, because a lot of people say, ay, no hay nada, and I don't know where to go. Well, that's what we're here for. There's institutions that have lactation experts, or that they give you information, or even us, or even on the internet. But you have to be very careful where you seek the information, because if it's funded by a formula company, they're going to tell you to breastfeed, and it's just as good, and it's not.
I would think that one of the primary reasons that we were encouraged to breastfeed was because the baby would be less colicky. And babies that drink formula tend to be more colicky than babies that are breastfed.
And a lot of the times it's the formula itself. The reason we did some literature review on why formula gets recalled, and it's because they find microorganisms that affect your digestive system. And so it could be the formula that's giving you and the infection, and also the way that the formula is prepared. I don't know if you've seen this, but I almost have a heart attack. Is that their mothers are in public and they're doing the formula, and then in the nipple they put their finger and they go like this. I mean, and because I remember, like in the old days,
I'm guilty.
In the old days. They would they had bottles and they would ¿cómo se dice? They
Sterilize?
would, yes, well at the house they would hervirlo.
They would boil it.
Boil it, and now they say, oh, this water is 100%. You can use as is, and it's not. You have to. There's the World Health Organization, UNICEF gives you the guidelines of, okay, if you're gonna breastfeed, if you're gonna bottle feed, but at least do it right, and that's why you're getting kids that have infection, because so the formula in itself is not good, and then if the procedure or the way that you're preparing it is iffy, well, of course you're gonna get colicky and sick babies.
I'm going to put you on the spot. Okay?
Oh my God.
So be prepared for this. What country leads in breastfeeding? Are there European countries?
Okay, well, right now I think the problem is worldwide. I think like here in the United States, the best breastfeeding statistics are in California.
Okay.
But they're because they're so natural, their mentality and mellow yellow and all that stuff, and so thank God, so they're at the forefront in the United States. In the world, it's not like it's only the problem in the United States. This is a crisis worldwide. This is why we're doing the Big Latch, and it's worldwide. What happened is that the formula companies, they go throughout the world. So right now,
even in third world countries where formula tends to be very expensive, and you would think breastfeeding would be natural.
There are some people that are so poor that that's the only option that they have, and thank God they breastfeed, okay? But there were studies that they've done with taromaras years back, and then what they were seeing with them was that because what they do is that they get pregnant really fast, no? So they have their baby, and then so they were seeing that babies up to 1 year old were not dying, but once they passed 1 year, they started dying, the babies. So what happened was that you would have your baby and you breastfed for a year, no? Then you got the other baby. So then you took the one that was older, you got the new one. So this had defense, but they were so poor and so bad condition and so malnourished that the baby that passed 1 year old, or when the other one kicked them out, that baby would die.
So infant mortality is a big issue.
Yes, and in the United States, the infant mortality is going up because we're not breastfeeding.
How do you go about spreading the message? I would think that that's such a big challenge.
People look at us
because
and we're
you're
crazy.
competing against
a big business and interest and misinformation. It's really misinformation, and even there's like mothers that, like my mom, didn't breastfeed me, okay? And I think that maybe they have like a sense of guilt, but that's at that time. That's the information that she had, and she really thought that she was doing what was best. So I can't get mad at her, and I can't because all mothers want their best for their babies. They do, and I'm not saying because somebody gives them formula they're a bad mother. But what is happening is that mother is not informed. She's receiving information that is only good for the formula companies. And there are cases where you do that the baby cannot be breastfed, and those are cases when, of course, if the mother dies, if the mother has AIDS, if the mother's taking certain types of cancer treatment. But even sometimes there's some types of cancer treatments that you can get the chemo, and then you pump, you throw the milk, and then the next let down, you can breastfeed. So, and women that are taking medications that are for, like, if they're depressed or bipolar and stuff like that, well, you cannot give the baby. But if you put all these women together in all these cases, really they represent 2%. That means that 90% of the women should be breastfeeding. Now, something that's happening nowadays because of the environment is that there's some cases that really, a couple of mothers that cannot produce milk. But still, that's something new that's related to the environment. But those are minimum still. So the thing is that it's hard. I'm not going to say it's not hard, but the thing is that it's hard because we are not used to it. Because before, like 75 years ago, you would get pregnant, you would have your baby, and you had your abuelita, or you had your mom, you had your sisters, your suegra, your mother-in-law, and they would show you how to do it. So right now, like my mom didn't know what to tell me. And when I was growing up, I don't remember seeing anybody breastfeeding. But what happened in my case was that I went to medical school, and when we were looking at the mammary gland, it's like, to me, it was a no-brainer. I was going to breastfeed no matter what, because that was what was the best, you know. Pero once it happened, and thank God my first son, he immediately took. So it was like in the movies, la 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 la. But with my daughter, for the first 4 days, she was very flojita, you know. She didn't wanna. She was very sleepy, and she didn't wanna eat, and I didn't wanna give her formula. So for 4 days, I had a friend of mine and myself and my husband, and I would express the milk, and we would give it with a syringe or with a with a dropper. On the 4th day, she took it, you know. So, but it was because
you had that persistence.
And other people are not. But you have to have support systems. So that's what we need to create. What do women need in order for breastfeed? Somebody to be there and hold her hand and talk to her and help her. And because there's going to be people that's going to be the most natural, easy thing. But there's also some instances that she's going to need help, and that's where we come in. And we really don't want anybody in Juarez, El Paso, Las Cruces to say, oh, there was nobody there to help me. Yes, we're here, and we want to do that.
What is the best way that people can get more information about your organization?
We're the Bi-national Breastfeeding Coalition, and we have a webpage, which is borderbreastfeeding.org. And we have a Facebook page, which is Border Breastfeeding BBC. And we have Gmail, borderbreastfeeding.gmail.com, I'm sorry. And so any of those, but the other thing is we're not the only ones. You have other agencies, and maybe later on we can talk about them.
Okay, Rosalba, I want to thank you very much for joining us right here on Fronteras, a Changing America.
Thank you very much.
Thank you for joining us on Fronteras, a Changing America. I'm Edmundo Resendez.